Thank you. Good afternoon, bonjour. Je tiens à souligner que les terres sur lesquelles nous sommes rassemblés font partie du territoire traditionnel non cédé du peuple Anishinaabe. Je suis heureuse d'être ici aujourd'hui pour discuter des résultats de 4 audits que mon bureau a réalisés sur la réponse du gouvernement à la pandémie de COVID-19. Avec les rapports que j'ai publiés plus tôt cette année, cela porte à 9 le nombre total d'audits que nous avons effectués sur ce sujet. Voyons d'abord notre rapport sur l'application de la quarantaine. Cet audit visait à déterminer si l'Agence de la santé publique du Canada avait amélioré l'administration des ordonnances de quarantaine obligatoires qui visent à limiter l'introduction au Canada du virus de la COVID-19 et de ses variants. The audit also examined how the agency implemented and enforced additional border control measures introduced in early 2021, including COVID-19 testing and the quarantine of air travelers at government-authorized hotels. Overall, we found that the agency improved its administration of the 14-day quarantine orders, with the move to collecting travelers' contact information electronically rather than on paper. The agency was better able to follow up with travelers. At the beginning of the pandemic, the agency was unable to confirm quarantine compliance for 66% of travelers arriving in Canada. Although we found that the percentage had dropped to 37%, this is not a success story. The agency's inability to confirm whether more than 1/3 of travelers complied with quarantine orders remains a significant problem. En ce qui concerne les nouveaux contrôles frontaliers, nous avons constaté que l'Agence n'avait pas d'informations ou qu'elle n'avait pu associer 30% des résultats des tests de dépistage de la COVID-19 à des voyageuses et voyageurs arrivés au pays. De plus, comme l'Agence n'avait pas de registre de séjour pour 75% des personnes arrivées au Canada en avion, elle ne savait pas si celles qui devaient se mettre en quarantaine dans un hôtel autorisé l'avaient fait. Les gens recommencent à voyager et des nouveaux variants continuent d'émerger. C'est pourquoi l'Agence doit améliorer sa façon de gérer et de faire respecter les nouveaux contrôles frontaliers qui visent à limiter l'introduction au Canada du virus de la COVID-19 et de ses variants. Our second audit looked at Employment and Social Development Canada's inspections of quarantine and other measures meant to protect temporary foreign workers in Canada's agricultural sector during the pandemic. Overall, we found that the department's inspections, whether they targeted quarantine, outbreaks, or basic accommodation requirements, provided little assurance that health and safety of temporary foreign agricultural workers were protected during the 2020 and 2021 growing seasons. We found that inspectors assessed almost all employers as compliant on both COVID-19 requirements and basic living conditions without gathering sufficient evidence. We started our audit work in this area in 2020. In December of that year, we decided to extend our audit to cover the 2021 season. And we shared our early and concerning findings with Employment and Social Development Canada. Our audit work in 2021 found that the quality of inspections had worsened, with 88% of quarantine inspections showing significant problems with quality and rigor, compared to 73% the year before. Timeliness was also a concern, with many quarantine inspections still incomplete long after the end of workers' mandatory 14-day quarantine period. We also found that outbreak inspections provided little assurance that employers were providing sick or symptomatic workers with accommodations where they could isolate properly, or even that basic living conditions were otherwise maintained. À 2 reprises pendant la pandémie, Emploi et Développement social Canada s'est engagé à changer son programme pour améliorer les conditions de vie des travailleurs et travailleuses étrangers temporaires. C'est un engagement du ministère qui remonte à 2018, mais nous n'avons constaté aucun progrès à cet égard. Ces résultats relèvent la présence dans le régime d'inspection du ministère d'un problème systémique qui exige une attention immédiate. Les préoccupations au sujet des conditions de vie des travailleurs et travailleuses étrangers temporaires dans le secteur agricole ne sont pas nouvelles. La COVID-19 ne fait qu'illustrer à quel point il est important que le ministère donne la priorité à la santé et sécurité des travailleurs et travailleuses étrangers temporaires et qu'il règle le problème des logements surpeuplés ou inadéquats. Il est plus que temps d'améliorer la situation des travailleurs et travailleuses étrangers temporaires qui viennent au Canada. These findings point to a systemic problem in Employment and Social Development Canada's inspection regime that needs immediate attention. Concerns about the living conditions of temporary foreign workers in the agricultural sector aren't new. COVID-19 provides another example of why the department needs to prioritize the health and safety of temporary foreign workers and deal with accommodation and that are overcrowded and otherwise inadequate. It is long past time to fix the situation for temporary foreign workers who come to Canada. I'm going to turn now to our third audit, which looked at programs to reduce food insecurity and support resilience in Canada's food processing sector during the pandemic. Overall, we found that these emergency programs helped to mitigate some of the effects of the COVID-19 pandemic on elements of Canada's food system. The departments and agencies drew on existing programs and mechanisms, consulted broadly, implemented oversight controls, and monitored funding to expedite emergency measures. However, we found a few cases where inconsistencies in program design resulted in unfair treatment of applicants and recipients across regions. De plus, en raison de problèmes liés aux données et à la mesure du rendement, les ministères et les organismes n'ont pas su si les programmes avaient atteint tous les résultats attendus. Du point de vue de la réduction de l'insécurité alimentaire ou du soutien à la résilience des entreprises de transformation des aliments. Le gouvernement a reconnu en 2009 que le secteur alimentaire est un élément d'infrastructure essentiel, mais il n'a pas élaboré de plan national d'intervention pour réagir à une crise qui toucherait l'ensemble du système alimentaire canadien. Agriculture et Agroalimentaire Canada devrait travailler avec ses partenaires et intervenants pour combler cette lacune. Passons maintenant au dernier des rapports que je présente aujourd'hui. Cet audit a porté sur le Fonds d'aide et de relance régionale, un programme de 2 milliards de dollars qui a fourni une aide de dernier recours à des milliers d'entreprises et d'organisations touchées par la pandémie de COVID-19. Les agences de développement régional ont mis à profit leurs expériences, leurs systèmes et leurs connaissances pour distribuer rapidement des fonds. Cependant, la gestion du programme a été affaiblie par un manque d'efficacité, d'équité et de transparence, qui peut avoir résulté des efforts déployés pour livrer le programme rapidement. We found instances where funding was awarded to applicants who did not meet all the eligibility criteria and where ineligible expenses were funded. We also found that applicants from different regions of the country faced different requirements to access funding because of regional development agencies' different approaches and interpretations of the eligibility criteria. In addition, because of weaknesses in reporting, the full impact of the program will not be known for years to come. In particular, the number of jobs maintained will be difficult to measure because of the poor quality of data. Innovation Science and Economic Development Canada should work with regional development agencies to improve the measurement and reporting of results for future funding programs so that progress against objectives can be tracked and shared. Our audits also aim to assess impact on people and the economy. In many cases, departments lacked basic indicators and targets against which to collect data and assess their impact over the longer term. This could be chalked up to incomplete planning due to the speed of the government's response, but it does point to some basic gaps in coordinating, monitoring, and reporting. It also presents an accountability challenge for governments when they are asked by their citizens to demonstrate value from money spent. Les audits COVID-19 que nous avons livrés jusqu'à présent montrent que même quand il existe des plans et des processus, comme dans le cas de notre audit des travailleurs étrangers temporaires, le gouvernement fédéral ne doit jamais perdre de vue son devoir de protéger la santé et la sécurité des populations vulnérables et de la population canadienne en général. Merci. Thank you. I'm now ready for questions.
Merci, Madame Hogan. Operator, since this is a virtual press conference and we don't actually have anyone in this room, all the questions will be on via the operator. Operator, could we get the first question? And everyone will get one question and a follow-up, une question puis un suivi.
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. La première question de Christian Noël, Radio-Canada. La parole est à vous.
Bonjour, Mme Hogan. Merci de prendre nos questions. La première question, c'est sur le manque de surveillance adéquate à la frontière, les mesures de quarantaine. À votre avis, à quel point est-ce que la santé des Canadiens a été mise en danger ou l'est encore en raison de ces lacunes?
Alors, dans notre audit sur les contrôles des ordonnances de quarantaine et de dépistage de la COVID-19, nous avons constaté que l'Agence de la santé publique du Canada avait amélioré son suivi avec les voyageurs. Par contre, si on va créer une exigence, il faut avoir travaillé toute la surveillance et le contrôle. Et c'est cela où ce que nous avons constaté les lacunes. Ça ne veut pas dire que les individus ne se sont pas confinés comme il le faut, mais que l'agence n'est pas en mesure de nous démontrer, à moi et à vous, que les mesures de contrôle ont été efficaces pour réduire la propagation du pandémie.
Donc, s'ils ne l'ont pas démontré comme il faut, vous n'êtes pas capable de nous dire, je présume, si ça a amélioré ou causer des problèmes à la santé en général des Canadiens. Ma deuxième question toucherait les travailleurs agricoles. Avec 95% des inspections qui ont été faites virtuellement, parlez-moi de la situation de vulnérabilité de ces travailleurs-là et à quel point le gouvernement a échoué à les protéger.
Alors, les travailleurs temporaires étrangers existent. Il y a un programme qui existe pour leur appui quand ils sont ici au pays. Et le programme existe pour combler la pénurie des main-d'œuvre dans le secteur agricole. Les inspections sont l'outil principal qui est utilisé par Emploi et Développement social Canada pour s'assurer que l'employeur, les fermiers dans la plupart des cas, ont protégé la santé et la sécurité des travailleurs étrangers temporaires. Les problèmes et les lacunes importantes et significatives dans le régime d'inspection ne nous donnent pas d'assurance que les employeurs ont bel et bien fait leur travail. Mais la responsabilité reste avec les employeurs. Et alors, c'est vraiment un échec du système de régime dans l'agence ou dans le ministère pour démontrer l'efficacité des mesures pour protéger la santé et sécurité des travailleurs temporaires.
Operator, next question. Prochaine question.
The next question is from Erica Walsh from the Globe and Mail. Please go ahead.
Good afternoon. I'm hoping you can confirm some more stuff on the border. The report says that it can only verify that 25% of travelers who needed to go to the authorized hotel quarantine did so. Does that mean that, do the numbers of people who checked into hotels also only show 25% of the people who needed to actually check in? Or is it just that the quality of information is so bad that they can't cross-reference the number of people checked in with who was actually supposed to be checked in?
There was a system set up between the public health agency and the designated, the hotels that were authorized hotels. So these are when travelers arrive from Canada and have to wait in a government authorized hotel for 3 days in order to receive the results of their upon arrival COVID test. The department had not set up a system to properly match all of the incoming travelers to ensure that they had actually stayed. So border service officers check that there is a reservation, but the agency was unable to confirm whether 75% of the individuals actually arrived at the hotel and stayed for those 3 days. So they were unable to show us that that measure was an effective preventative measure.
And so going off of that, I mean, we now saw that the government has reintroduced some of the rules around the designated quarantine facilities. Do we know if they have a better tracking rate with the designated quarantine facilities? Do we know if they have what their numbers are in terms of verifying the passengers that are supposed to be there? And do we have any evidence that shows that either the government authorized hotels or the designated quarantine facilities actually stopped any spread of COVID-19?
So when it comes to the designated quarantine facilities, during the period that we audited, so I can't really speak to what's happening now because the measures have changed since our audit work completed. But during the period that we audited, we know that the majority of individuals presented themselves at a designated quarantine facility. There was a small number that did not. So I would trust that the department has now going to draw on the lessons learned, right? They were able to improve the ability to contact individuals when they came through the border to see if they were quarantining. They need to take those lessons learned and apply them to the other border measures. And they can't underestimate the need to have good data to be able to do that. If they're going to put in a requirement, they really do need to have worked through how to monitor and enforce that requirement. Now, we don't have enough information in order to be able to determine a causal link between the spread of the virus and individuals coming into the country. There's so much more information about health-related matters that the agency doesn't have and that we don't have.
Thank you. Operator, next question. Prochaine question.
The next question is from David Aiken from Global News. Please go ahead.
Thank you very much. I wonder if I just follow up on your last point about that causal link. When I read a statistic that says 1,100 Canadians or travelers who tested positive never received a follow-up from PHAC during the audit period, I don't know if I need to be an auditor or a public health expert to make 1 + 1 = 2 here. That would it be your opinion that there was an elevated public health risk because of the inability of PHAC to track, monitor, and follow up on, at the very least, 1,100 people who tested positive?
Well, I firmly believe that Canadians are all good rule followers, and I trust that they'll continue in respect the rules. What we were looking at was not whether Canadians were properly quarantining and following the guidance at the border, but whether or not the agency was able to show us that they were tracking and monitoring compliance to demonstrate the effectiveness of the border measures. When it comes to COVID testing, you rightly point out, there was 30% of test results that were either missing or unable to be matched with incoming travelers, but even more concerning, just over 1,000 who had tested positive where the agency could not reach them. However, the lab that completed those tests likely would have reached out to that individual. But when there is no evidence for us to be able to determine whether or not the person was reached, all we can tell you is that they didn't monitor and enforce the requirements properly.
And I'd be remiss if I didn't ask you that we are meeting virtually, and one of the reasons I understand we're having to do this virtually is because we have 170 employees of the Auditor General of Canada that are on strike. Can I ask you, how else is that strike affecting your ability to do the work Parliament has charged you to do? Is it impacting any audits?
Well, first off, I want to start by saying how much I appreciate all the amazing work of every single individual who works for our organization and their professionalism and dedication to serving Canadians and Parliament. The impact of the labor dispute obviously had some impact on the quality of the aesthetic look of our reports today. But because of the great work of our audit services group, the audit reports were so far advanced when strike action took place that our management team was able to complete them. Now, I have to tell you how deeply concerned I am and preoccupied by the stress and the pain that the situation is causing my employees, as well as the toll it's taking on our entire organization. The impact that it will have on the office, I do plan to share some information with Parliament next week, talking about the impact on our office, about how we are in this labor situation, about my powers and the limitations on my powers. And I'll be happy to answer questions next week once I have shared that information with Parliament.
Thank you. Operator, next question. Prochaine question.
The next question is from Mackenzie Gray from CTV News. Please go ahead.
Thank you for taking our questions. I just wanted to narrow down. It seems that 2 of the 4 airports that had international flights coming to it hadn't issued any tickets regarding violating or not complying with quarantine orders for hotels in particular. So that's Alberta and Quebec. Could you tell us where this fell apart? How come, like, for example, Quebec, Saskatchewan, and the territories didn't adopt a ticketing regime? What could have been done differently to actually have some of these measures enforced?
So the purpose of the ticketing was to ensure national enforcement of the quarantine measures. And it's clear from our findings that the Public Health Agency of Canada didn't have a cohesive enforcement approach. So some of the provinces did not sign on to the Contraventions Act and then hence didn't follow the normal ticketing regime. And we also saw that when they did, there was uneven ticketing. And I think this points back to that sort of fundamental statement that I made even earlier on, that if you're going to create a requirement, one that you expect will be enforced nationally, you really have to have thought through the monitoring of it, as well as the enforcement, the powers that are needed, and all the mechanisms behind. And it's clear here that this was more reactive than proactive, and that's an improvement that'll be needed next time we have to face such a crisis.
The next time could be right now, as the Omicron variant is out there. How much concern do Canadians have that, as to your last audit, the agency still can't really effectively track those or cannot verify compliance of quarantine orders for up to 37% of people, like a third of people that are coming into the country, they can't verify these quarantine orders. So how much should that concern people about the other variants like Omicron that could increase transmission throughout the country?
Well, I'm concerned that the agency is unable to show us whether or not these border measures are effective border measures. But I continue to follow public health guidance, and I encourage all Canadians to continue to follow public health guidance. We have come together and done a great job, and let's not stop doing that, even though we're many months into this. But it really is up to the Public Health Agency to do better at monitoring, at gathering data, and following up in order to be able to demonstrate how effective these border measures are.
Thank you. Operator, prochaine question. Next question.
Thank you. The next question is from Karina Roman from CBC News. Please go ahead.
Yes, hi there. My first question is, we do have these new measures or reintroduced measures now at the border that are in place with lots of stories about, delays and hotel problems and stuff. How confident are you that PHAC can manage these new border ones now that you've looked at what they did in the past?
Well, if we look at the results from the two audits, so we did our first audit on border control measures back in March. And at the time, the Public Health Agency was unable to confirm that 66% of travelers had properly quarantined. So while that percentage is getting better, and they're learning some lessons, they've gathered data electronically. The Arrive Can app is improving their ability to contact travelers. I was disappointed that they were unable to take those lessons learned and put them to other border measures. So now I'm hoping that we're sitting here looking at a second round of results that are concerning, because while the percentage is improving, the number of travelers entering the country is also going up. And so it is still important and needs better attention and better diligence. So there are some steps that they need to take in order to give assurances to Canadians like you and I that these border measures are effective.
And in terms of the temporary foreign workers, you've seen as things actually got worse from one audit to the next. You talked about it being a systemic problem. I'm wondering if you can give any sense of whether there's any confidence that you have going forward that things will improve for these vulnerable workers. And if you could describe as well some of what you discovered about how they were living and treated during your audit.
Well, I want to start off by saying that the Public Health Agency acknowledged the findings of our report and recognize that they need to step back and do differently. What we found throughout the audit was, we asked ourselves the question about why did this happen, and we highlighted a few reasons. And I guess some that I would bring up are that the sense of urgency really didn't resonate throughout the inspection regime. When you have 14-day window to verify quarantine compliance, you need to start and complete an inspection in that 14 days in order to demonstrate that individuals are able to properly quarantine. The department didn't properly assess the capacity of inspectors, and the oversight mechanisms were really ineffective. And so when you sit back and you look at those kinds of results where 88% of inspections could not demonstrate that the employer was protecting the health and safety of workers, it just leads you to conclude that it is a systemic problem throughout the entire regime. And I'm confident that they've heard me, but they now need to sit back and definitely do differently going forward because temporary foreign workers need better living conditions.
Thank you. Operator, next question. Prochaine question.
La prochaine question de Catherine Lévesque, La Presse canadienne. La parole est à vous.
Oui, bonjour, Madame Hogan. Ma première question, en fait, c'était toujours sur les mesures aux frontières. Je me demandais quel est l'élément qui vous a le plus choqué, je pense, dans vos découvertes? Est-ce que c'est le fait que l'agence, après tout ce temps, est encore incapable de confirmer que plus du tiers des Canadiens, en fait, font la quarantaine? Ou est-ce que c'est le fait que l'agence, en fait, n'avait pas de surveillance là, que pour 25% des voyageurs qui allaient bel et bien à l'hôtel de quarantaine? Quel élément vous a le plus choqué?
C'est une excellente question. J'avoue que l'élément qui me préoccupe probablement le plus, c'est qu'ils ont mis en place des mesures, mais qu'ils n'ont vraiment pas travaillé ou pensé à la surveillance et le contrôle. Ce ne devrait pas être compliqué. Puisqu'on a vu de l'amélioration depuis mars à maintenant, je m'attendais qu'ils auraient appris des leçons, tiré des leçons apprises de la première audit et de les mettre en place pour améliorer les mesures de contrôle. Alors, c'est vraiment le temps de trouver quelles données qu'on devrait avoir, comment qu'on devrait recueillir ces données et comment qu'on va démontrer aux Canadiens que les mesures à la frontière sont efficaces.
Merci. Puis, je voulais aussi revenir sur le manque d'uniformité là, des données entre provinces en ce qui a trait aux contraventions. Donc, en fait, le manque d'uniformité, c'est un problème que vous aviez relevé lors de votre dernier rapport. Comment est-ce que vous avez réagi en constatant que l'agence était toujours incapable d'avoir un portrait clair de la situation et dans ce cas-ci des contraventions?
Mais dans la situation des contraventions, c'est un petit peu particulier parce que chaque province doit s'enregistrer ou pour être en mesure d'émettre des contraventions. Mais pour moi, c'est vraiment, si je prends du recul, c'est une question de collaboration entre les différents niveaux du gouvernement ainsi que des parties prenantes. Et à ce point ici, après presque 2 ans dans une pandémie, on devrait moins être en mode réactif et plus en mode proactif. Et on devrait être en mesure d'avoir un contrôle qui est plus uniforme à travers le pays.
Operator, next question. Prochaine question.
The next question is from Laura Osman from the Canadian Press. Please go ahead.
Thanks for taking our questions. I wanted to follow up on my colleague Karina's question about the border measures. Public Health says they were able to institute an automated process for check-in and check-out data to sort of facilitate enforcement for non-compliant travelers in the last month of your audit. Did you see a meaningful change in that last month of the audit that might give you more confidence moving forward in these sort of mandatory quarantine orders?
I'm not sure that I know all of those details right off the top of my head. I do know that we saw an improvement in their ability to contact travelers throughout our audit. So if we go back to the period of our first audit, where they couldn't contact 66% of the employers, the travelers, we saw that improve by the end of the year to about 58%, and then improve again at the end of our audit period to 37%. When it comes to the hotel stays, really there was very little records for us to be able to even notice a blip. When you're missing records of stay in 75% of the cases, it's a sign that something needs to be done differently so that you can have a better handle on that information.
And then on the ESDC's inspections, I'm wondering if you can speak a little bit to the impact it might have had on the migrant workers themselves during the pandemic, and whether you think it's possible that any of them died as a result of the improper inspections.
So again, making a causal link between the poor quality of inspections and either temporary foreign workers being ill or passing away is one that requires a lot more information than what ESDC or my auditors were able to look at. It requires a lot of health information. It's just something that none of us have. And so making that causal link is impossible. But it is sort of a fundamental if you step back and say everyone needs to be able to properly isolate or quarantine when they arrive in country to ensure the safety of others. That's just a fundamental thing that we've all learned throughout the pandemic, that you need social physical distancing and good cleaning supplies. And so there's just basic elements that every person should have access to, and temporary foreign workers are relying on their employers to provide that to them. And here what we found was that the agency was not doing a good job at making sure that employers were meeting those requirements.
Okay, thank you. Operator, next question. Prochaine question.
La prochaine question de Annie Guillemette, Cogeco Nouvelles 98.5 FM. La parole est à vous.
Bonjour, Madame Hogan. Ma première question, encore à propos des frontières, je voulais vérifier là, avec les améliorations, entre guillemets, avec l'application ArriveCan. Est-ce que vous êtes en mesure de dire aujourd'hui, ça peut ressembler à quoi? Avez-vous eu des retours là, sur les effets à moyen terme, je dirais, là, au bout de quelques mois, ça peut ressembler à quoi?
Alors, la période de notre audit a terminé le 30 juin de 2021. Je n'ai pas fait de suivi avec l'Agence de la santé publique du Canada depuis ce point-là. Mais ils ont répondu à nos recommandations et ils se sont engagés à faire des améliorations dans leur processus. Et alors, je pense que c'est une question mieux posée à eux pour savoir s'il y a une amélioration aujourd'hui.
En suivi, concernant les travailleurs étrangers, j'ai été un peu étonnée d'apprendre qu'on vérifiait pas systématiquement s'il y avait de l'eau potable pendant les quarantaines et l'isolement. De votre côté, est-ce que c'est quelque chose qui avait déjà été vu? Il me semble que ça frappe l'imaginaire. Là. On ne regarde même pas s'il y a de l'eau dans un endroit où on est isolé. Là.
Alors, il faut comprendre un peu le changement qui a eu lieu dans les inspections durant la pandémie. Avant la pandémie, vérifier les conditions d'hébergement, l'eau potable, c'est quelque chose de très régulier dans les inspections. Durant la pandémie, au moins au début, les inspections des facteurs réguliers sont arrêtées. Et c'est vraiment les 6 mesures additionnelles reliées à la COVID qui ont été subies à des inspections. Durant la pandémie, ils ont redébuté. Regarder les conditions des hébergements. Et vraiment, on a constaté qu'il n'y avait pas de preuves sur les dossiers du tout que ces éléments-là ont été vérifiés. Et oui, ça me préoccupe beaucoup les inspections n'ont pas démontré que les employeurs respectaient des exigences sanitaires ainsi que les exigences de base reliées aux hébergements. J'aimerais juste aussi mentionner que chaque province doit au moins faire une inspection d'une ferme et que cette inspection-là devrait regarder s'il y a de l'eau potable, des salles de bain dans les hébergements et que ça, c'est au moins le point de départ pour accéder au programme des travailleurs étrangers temporaires. Alors, ça a été vérifié au moins une fois, mais ça devrait être vérifié plusieurs fois à travers les inspections.
Thank you. Operator, prochaine question.
The next question is from Anne Hui from the Globe and Mail. Please go ahead.
Hi, good afternoon, Ms. Hogan. On the temporary foreign workers report, I'm hoping you can elaborate further on your decision, even after completing that initial audit, on why you decided not to make the results of the report public at that time, especially given the imminent arrival of thousands more migrant workers.
I do want to start off by saying that I am deeply concerned and disappointed that the situation did not improve after I spoke and wrote to the department about the significant findings back in December of 2020. At that point, you may recall that I did inform Parliament with my reports in March. I issued a special report to Parliament, and I talked about the significant weaknesses that we had found in the inspections up until that point. And honestly, I had hoped that our continued pressure on the department to continue to audit would have helped improve the situation. And so now it really is time for them to sit back and take a hard look at their inspection regime, because it is long past due to improve the conditions of temporary foreign workers when they're in our country.
I'm wondering specifically what assurances you were given at that time from the government on how they might change their behavior going forward. And I'm just curious because earlier you said that you are confident that going forward that the department will be making changes. I'm wondering where that confidence comes from now.
I did say that I was confident that they acknowledged our findings and that they would do something. I think back in December when we spoke to them, they committed to improving their inspections. And one of the steps that they took was to add an extra layer of oversight, a quality sort of assurance process, that once an inspection was completed, that it would go through this quality assurance process to ensure that there was proper evidence and documentation and that a good judgment call had been made. The issue is, as we reported in our report, that so many files, about 80% of I think it's a little over 4,000 quarantine files, were sitting in a backlog or were sitting inactive, and hence never made it to this extra quality assurance process. And so I really do hope that now the department will sit back and not just add another layer of process, but will sit back and take a real fundamental look at the capacity of inspectors, the training of inspectors, and how they go about carrying out these virtual inspections so that they can be more effective going forward.
Thank you. Operator, next question. Prochaine question.
Thank you. Merci. The next question is from Chris Nardi from National Post. Please go ahead.
Hello, Ms. Hogan. I also want to follow up on the temporary foreign worker audit. I was wondering, now that you know that the situation actually got worse since you first looked at this program, do you regret not publishing the findings of that initial audit, thinking that maybe a little bit of name and shame might have actually put the wheels of change into motion as opposed to letting the department just sit on it and make it worse?
Back in December, I asked the department to prioritize the health and safety of temporary foreign workers over responding to audit recommendations and developing an action plan. I actually expected them to take concrete action to improve the living conditions of temporary foreign workers and to improve the quality, rigor, and timeliness of their inspections. So I think it was the right call to ask the department to prioritize the health and safety of these workers, and it's disappointing that they were unable to do so.
And do you think you're ever going to give a department a chance like this again?
Well, I don't think any situation is the same, and you have to look at the facts at the time. And I think when it comes to health and safety, I will always prioritize the health and safety of Canadians and workers that are here supporting us. And so I think it'll depend on the situation next time.
Thank you, operator. Next question. Prochaine question.
La prochaine question de Olivier Ferron-Boissé de TVA. La parole est à vous.
Oui, bonjour, merci de prendre nos questions. Je veux revenir sur les mesures de contrôle aux frontières. Bon, à la lumière de ce que vous avez collecté comme information, comme données, on en a parlé plutôt en anglais notamment du fait que de nouvelles mesures avec les variants Omicron, nouvelles mesures de quarantaine aussi, mais ce que je me demande, c'est est-ce que le gouvernement réellement a la capacité de tester tout le monde, la capacité de s'assurer de faire des suivis de la quarantaine? Est-ce que dans le fond, elle a les moyens de ses ambitions réellement?
C'est une excellente question que je vous encourage de demander à l'Agence de la santé publique du Canada. Nous avons constaté lors de notre première audit au mois de mars qu'il y avait un manque de capacité. Et en effet, on a vu une amélioration ce fois-ci dans la capacité de l'Agence à contacter des individus. Il y a plusieurs personnes qui ont engagé un contrat, ils ont fait des partenaires avec les forces de l'ordre. Alors, il y a des moyens à augmenter la capacité, mais c'est vraiment de voir là pour la prochaine fois ou pour les prochaines mesures qu'ils mettent en place, de vraiment penser un peu au contrôle et à la surveillance d'une mesure. Juste mettre une mesure en place sans vraiment avoir penser à la meilleure façon de s'assurer qu'elle est efficace, n'est juste pas du bon fonctionnement, de la bonne gestion. Et alors, c'est juste d'améliorer ces choses-là pour être en mesure de nous démontrer que les mesures sont efficaces ou non.
D'accord, merci pour ça. En suivi, je suis curieux sur d'un autre rapport, celui sur l'aide là, pour les petites entreprises touchées par la pandémie. Vous dites qu'il semblait manquer d'indicateurs de performance, que c'était difficile pour l'instant de vraiment dresser le portrait à savoir si ça a fonctionné, combien d'emplois ont pu être sauvés. Je me demandais simplement si vous aviez une idée de quand on pourrait avoir une idée de la performance de ces programmes-là. Puis, puisqu'il manque d'indicateurs, en fait, c'est sur quel indicateur on va pouvoir se baser pour vraiment plus tard remarquer si ça a fonctionné ou non, ces programmes-là?
Alors, vous parlez du fonds d'aide et de relance régionale. C'est un fonds qui a fourni soutien financier de dernier recours à plusieurs entreprises et organisations. C'était plutôt visé sur des petites entreprises avec moins de 500 employés. Un des objectifs de ce programme était de maintenir des emplois. Et l'autre objectif était aussi de fournir 25% du financement au secteur du tourisme. Mais quand ça vient à maintenir des emplois, ce qu'on a constaté durant l'audit, c'est que les agences fédérales de développement régional n'ont pas bien cueilli de l'information sur le nombre d'emplois par employeur. Et ils se sont fiés sur de l'information fournie par les demandeurs de financement. Alors, ils sont pas en mesure de démontrer que les emplois ont vraiment été sauvegardés. Ça va prendre, j'imagine, quelques années parce que l'objectif était que les emplois existent à la fin de la pandémie. Et comme on le sait tous, on est encore dans le milieu de la pandémie.
Merci. Operator, next question. Prochaine question.
Thank you. Merci. As a reminder, you may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. La prochaine question de Christian Noël, Radio-Canada. La parole est à vous.
Merci beaucoup. J'aimerais revenir sur la question de mon collègue. Est-ce que le gouvernement peut dire présentement qu'ils ont les moyens? Est-ce que vous avez remarqué qu'ils avaient les moyens de surveiller le respect des mesures à la frontière?
Je crois que les constatations dans notre audit, c'est qu'ils n'ont pas les moyens en ce moment et ils ne se sont pas bien préparés pour être en mesure de démontrer si les mesures de contrôle à la frontière sont efficaces.
Merci beaucoup. À propos des travailleurs étrangers temporaires, encore une fois, au niveau agricole, dans quelle situation se sont-ils retrouvés?
Je ne sais pas si je comprends bien la question.
Oui, vous faites état de différentes situations, de différentes conditions préoccupantes. À quel point ces conditions étaient préoccupantes? Pouvez-vous nous donner des exemples de choses qui survenaient ou que vous avez vues dans les rapports et qui auraient pu être réglées plus rapidement?
Alors, la plupart des inspections que nous avons vérifiées, c'était des inspections soit de quarantaine ou des inspections d'éclosion. Dans ce cas-là, une inspection de quarantaine, il faut s'assurer que les employés temporaires étrangers qui arrivent au Canada peuvent s'isoler des autres employés temporaires qui sont déjà ici. Ce qu'on a constaté, c'est que des fois, il n'y avait pas une place pour s'héberger qui était séparée des employés qui étaient déjà ici au pays. On a vu un manque de preuves pour démontrer que leurs hébergements leur donnaient la possibilité d'avoir la distanciation sociale. De temps en temps, on a aussi vu qu'il n'y avait pas de vérification s'ils avaient accès à une salle de bain pour eux-mêmes lors d'une éclosion. Alors, vous pouvez comprendre que durant une éclosion, il faut s'assurer que ces individus-là sont vraiment isolés de toute autre personne sur la ferme et les dossiers ne démontraient pas que les inspecteurs avaient vérifié ces points qui sont vraiment fondamentaux pour mitiguer la propagation de COVID-19.
Merci. Operator, next question. Prochaine question.
There are no further questions at this time. Nous n'avons plus de questions pour le moment.
Okay, with no further questions, I thank you all. This ends this press conference. Thank you.
Thank you, merci.